Wells Plastic Surgery is holding a lunch event about facial rejuvenation.
Dr. Henry G. Wells Jr. joins us with more on the event. Were the parents or grandparents literary fans, H.G. Wells?
Well, of course they were, but I was named after my father. His name is a little bit different.
Oh, okay, a little bit different. Right. Well, even H.G. Wells couldn't dream up some of the stuff that you guys can do today. I mean, with this facial rejuvenation, what are we talking about?
We have, plastic surgery has changed quite a bit over the last few years. It used to be a facelift was just simply tightening up the skin, and that was about it. Today, we not only tighten up the skin, but we tighten the underlying structures. And another important part of facial rejuvenation is volume replacement, or adding fillers to the mid-face. And then again, there are other procedures that we do, like brow lifts and eyelid surgery, which we can add to that.
And are we able to maintain the look so that it's not artificial looking?
Well, I think the way we're doing it now, with volume replacement and the lower face lift and neck lift that we do, I think we do get a more natural look, because before we were trying to tighten the face by pulling it up as tight as we could. Now with volume replacement, we don't have to do that. Instead of pulling it tight, we fill in the volume, and that'll give you a more natural lift.
Oh, I think we're just seeing some examples of the work. This is that was interesting. I think that was the same lady I just saw here, wasn't it?
Yeah, it looked like it was underneath her neck.
Yeah, she's almost a generational change. She has a great result. She had a facelift, a lower face lift, neck lift. I actually had a eyelid surgery, and then she went to our skincare program and had volume replacement in the cheeks and Botox and other facial fillers. So she had the full treatment, and that's the one thing I'd like to emphasize about our program is it's a team approach, and I think that's probably what makes us unique, is that we not only do surgery, but we also do skin care, and together we can give the patient the optimal result.
But nothing lasts forever. So if we get that done and we have maintenance, how long is it a period between the initial process and having to get maintenance treatment?
Well, that depends a lot on the condition of your skin and how old you are to start with. Older patients, their results aren't going to last quite as long as younger patients. But I always tell my patients that if you have a facelift, you are never going to be like your peers who've never had it. You're always going to be ahead of them.
In your occupation, I mean, is it obviously science-based, but I mean, there's a little artistry to this as well, isn't there? I mean, how's that approach?
Well, I like to think so. I mean, we all have an idea of what a facial aesthetic should be, and there are certain principles that we adhere to when we do surgery. But I think it is part art and part science.
Is some of it discipline too with you guys, to say to the patient less is more on occasion? I mean, do you have that thought as well?
Well, I like to listen to the patient, and then I will make my recommendations based on what I think is feasible for them to do. Now, as far as how I approach surgery myself, I'm relatively conservative. I don't want a done look. I would like for the patient to look natural. And that's the most important thing to me, that they look fresher and younger, but not different.
Exactly.
Well, you can learn a lot more. The Facial Rejuvenation Lunch and Learn event is set for February 20th from 11:30 to 1:30. It's going to be at Mickey Salon Spa Event Room, which is located in the Shinaway Village Shopping Center. Admission is free, but make sure to reserve your spot before they fill up. Call 859-255-6649. And to learn more about Wells Plastic Surgery, log on to wellsplasticsurgery.com.
Doctor, thank you so much for stopping by. Very
interesting.
interesting.
Pleasure is all mine.
Good to see you.
Hang out there, because we're going to take a quick break and come back with our pet of the day.